In today's video, we're going to the best special test to diagnose cervical radiculopathy. So what is a cervical radiculopathy? A cervical radiculopathy is going to be some sort of irritation or injury to the nerves as they exit the spine in the intervertebral foramen. This can be caused by a variety of things. So for one, it can be due to degenerative changes over the course of time from some arthritis and hypertrophy of the joints of the luschka, or some changes in the discs. The discs actually get smaller over the course of time. What happens is that decreases the space where the nerves live in the intervertebral foramen. The other thing that can occur is that we can have a disc herniation. So if you have a disc herniation and it's posterior lateral, so the bulge is pushing out into the nerve, that mechanical compression up against the nerve can cause a cascade of inflammation and pain. That would be referred to as radicular pain. If you have any deficits from a neurological standpoint, so changes in sensation, weakness, or reflex changes, that would be a radiculopathy. So accurate diagnosis is important because the way you treat cervical radiculopathy is a little bit different than the way you treat generic neck pain. The other piece is oftentimes these folks have pain into the shoulder, or we're trying to figure out is this a shoulder issue or is this a neck issue? We know these tests aren't perfect. So there's a lot of asymptomatic pathology within MRIs of the neck. So folks who are going to have disc pathology doesn't always mean that's going to be the cause of your pain. Same thing goes through these electrophysiologic studies and tests. They're not perfect. So the sensitivities and specificities of the test I'm about to show you are going to be compared to the gold standard of MRIs and also these studies from an electrophysiologic standpoint, and they're not perfect, all right? So take all that with a grain of salt. Spurling's test. Now this test is described in our literature in a variety of ways. The first of which is with extension and ipsilateral flexion. So you can have your patient sit on the edge of the table, and from here, we're going to extend the neck maximally. Then we're going to laterally flex the neck towards the side of your symptoms, and then we're going to apply a bit of overpressure. Now, a positive special test would be the reproduction of the patient's familiar radicular symptoms. So things like numbness, tingling, pain that shoots down the arm, local soreness and tightness in the neck would not be a positive special test. You can also assess the Spurling's test with a combination of ipsilateral lateral flexion as well as ipsilateral rotation. So we're going to have you take your head here and maximally laterally flex, and then we're going to rotate as far as you're able to, and I'm going to apply some overpressure. And again, a positive special test, you can relax for now, would be a reproduction of those radicular symptoms. Cervical traction or distraction test. So I have your patient lay on their back, head towards the practitioner. I'm going to take my left side hand, go underneath of the head, just like so. I'm going to take my right side hand and go underneath of the chin. So you have to make sure your patient knows you're about to do this, and you want to make sure they're not going to bite their tongue off, right? So from here, I'm going to apply about 10 to 15 kilograms of force towards me, distracting the head. And that's how you relax for now. And basically, if there's a reduction in the patient's radicular symptoms when you're pulling away, that would be a positive special test. The next is going to be a test of channel subscription. So you just take your patient's finger, have them point their finger straight ahead, just like so. You take their finger and you have them press on the Fitness Pain-Free subscribe button, just like that. Have them like the video. Very extremely effective. Upper limb neural tension test 1. This is for a median nerve bias. You have your patient back, involved side towards the practitioner. I'm going to take the patient's arm, like so. We are going to depress the shoulder. We're going to abduct the shoulder to 110 degrees. From here, I'm going to laterally rotate and then extend the elbow fully. And the last piece, well, second last piece, we extend from the fingers and the wrist and then laterally flex the neck over to the uninvolved side. You can relax now. A positive special test would be the reproduction of your patient's radicular symptoms. Make sure you're checking left to right. If it's just a little bit tight, that's not a positive special test. Upper limb neural tension test 2A. This is for the median nerve. So what we're going to do is take the patient's arm. First step is going to be depressing the shoulder. We want to be in 10 degrees of shoulder abduction. We're laterally rotating from the shoulder, although I know you can't see that here. We're going to be fully extending from the elbow. We're going to be extending from the fingers as well as the thumb. And the last step is we're going to take the neck over into lateral flexion towards the other side. A positive special test would be the reproduction of the patient's familiar radicular symptoms. Upper limb neural tension test 2B. From here, you take the patient's involved side arm. I'm going to depress the shoulder. From here, I extend at the elbow. I'm going to medially rotate the arm fully. And from here, I'm just going to flex the wrists and the fingers. And the last step is to laterally flex the patient's head towards the contralateral side. A positive special test would be the reproduction of the patient's familiar radicular symptoms. Upper limb neural tension test 3, ulnar nerve bias. So you're going to take the patient's involved side arm. From here, I'm going to depress the shoulder. I'm going to abduct into 110 degrees. From here, I externally rotate the shoulder like so. I'm going to pronate the forearm, extend at the fingers, push out that thumb, and then I'm going to flex the elbow. Last stage is taking the neck and laterally flexing to the contralateral side. A positive special test would be the reproduction of the patient's radicular symptoms. Val Salva Test. This test is designed to increase intraspinal pressure. So have your patient sit on the edge of a table. From here, take a nice deep breath in, hold it, and then from here, bear down like you're taking a bowel movement, right? And then relax. A positive special test would be the reproduction of your patient's familiar radicular symptoms. Shoulder abduction relief test. So you take your patient with the involved side arm, bring their hand and wrist over the top of the head and have them rest it on the top of their head. If this reduces the patient's familiar radicular symptoms, this will be a positive special test. The test is designed to slack all the nerves from the neck to the hands. Squeeze test. You have your patient sitting on the edge of the table. For the involved side arm, we're going to squeeze at the acromioclavicular level, at the subacromial level, and then we're going to squeeze at the bicep and tricep area. A positive special test would be having more pain when squeezing the bicep and triceps area, greater than a 3 on a 0 to 10 scale. The idea for this test is if you have some sort of cervical radiculopathy, the nerves are irritated as they travel between the biceps and the triceps. When we squeeze that, that should be provocative, right? The test is, in theory, supposed to be useful for differentiating between pain within the shoulder and with the cervical spine. So now you have some good tests for diagnosing cervical radiculopathy. You still need to know some treatments. I have a video for you up in the corner. We go over my favorite deep neck flexor exercises to treat your patients with cervical radiculopathy. So go ahead and click on that link, and I'll see you on the next video.